Hi, my name is Arshpreet Kaur and I'm from Fresno Pacific University, United States. Today I'm presenting my PowerPoint on the influence of drug in pregnancy. In this presentation, I'll discuss how drug use is highly common during one's pregnancy phase places a significant risk to both maternal and fetal health. Studies state that the drug use contribute to complications including a preterm birth, low birth weight, congenital disabilities, and long-term neurodevelopmental issues. According to the numerous studies, a high percentage of adult pregnant women drink alcohol, as well as a high prevalence of adult women who use tobacco. It is noteworthy that parental exposure to a substance like alcohol, opioids, as well as other stimulants, to say the least, certain prescription medications have been associated with the poor fetal development, as well as long-term physical and cognitive impairments. For instance, studies state that some commonly used medications such as a selective serotonin reuptake inhibitor, also called SSRIs, and non-steroid anti-inflammatory drugs, also called as NSAIDs, can lead to birth defect and developmental concerns. In addition, it is said that prenatal exposure to alcohol is a prevailing cause of prenatal intellectual disability, with the fetal alcohol spectrum disorder affecting up to 5% of the children in certain population. To take a note, the consequences of a drug exposure during the pregnancy goes beyond birth. The health stakeholders must address this issue by implementing preventive strategies to practice or to reduce complication associated. Women can be provided with a prenatal care program that include early screening for substances use and patient education. In addition, these women can be provided with a multidisciplinary support. Additionally, it is vital that the provider take a note of effectiveness of public health initiative and policy regulation in raising awareness and ensuring the access to safer alternatives. Introduction. The use of a drug during a pregnancy holds a significant negative impacts on maternal and fetal health. Pregnancy is a critical period and the use of illicit substances, prescription medication, as well as over-the-counter drugs can negatively impact the growth fetus as well as a pregnant woman. The Centers for Disease Control and Prevention 2024A study states that between the year 2010 to 2017, there was an increase in the number of women with opioid-related diagnosis at delivery. Additionally, the number of those who had been hospitalized was noted to have increased by 131%. As a result, opioid use leads to stillbirth, maternal death, preterm birth, and neonatal absence syndrome. Other studies have reported that the substance such as alcohol, opioid, or stimulant have a teratogenic effect that can lead to congenital abnormalities, cognitive impairments, and neurodevelopmental disorders. It is worth taking note that impact of a prenatal drug exposure extend beyond birth. Affected children have been seen to suffer from conditions like NAS, fetal alcohol spectrum disorder, among other developmental challenges. In turn of these have hindered their quality of life. In addition, some common medications like antidepressants and NSAIDs have been linked to the birth defect. Therefore, patient education and other effective strategies must be utilized to prevent drug-related complications during pregnancy. That said, this paper explored the influence of a drug during pregnancy, a discussion of their consequence-associated risk, and prevention approaches to improve maternal and neonatal health outcomes. Types of drug and their effects. Illicit drugs. Studies has linked illicit drugs, including cocaine, methamphetamine, heroin, and marijuana, to detrimental effects on fetal development. For instance, cocaine have been said to restrict the blood flow to the placenta, leading to fetal hypoxia, preterm birth, and low birth weight. On the other hand, methamphetamine use is said to lead to poor growth, behavioral abnormalities, and cognitive impairments in infants, according to Smith in 2020 study. Heroin and other opioids significantly increase infants' risk of NAS, stands for neonatal abstinence syndrome. In turn, newborns may experience withdrawal symptoms such as feeding difficulties and respiratory distress. Opioids can also result in a disability and maternal mortality, according to the Centers of Disease Control 2024A. Prescription and over-the-counter drugs. Certain prescription and self-medication over-the-counter drugs can pose significant risk to maternal and fetal health, according to Alosami 2022 study. For instance, SSRIs used in managing depression during pregnancy have been said to lead an increased risk of a persistent pulmonary hypertension in newborn, while NSAIDs such as ibuprofen are highly linked to premature closing of a ductus arteriosus, leading the fetal cardiovascular complication, according to the Date 2022 study. Alcohol and tobacco use during pregnancy. Alcohol has also been associated with a negative impact during pregnancy. Alcohol consumption is said to lead to FASDs, which manifest with intellectual disabilities, growth deficiencies, and facial abnormalities. According to the Popova 2023 study, FASDs affects 1 to 5% of grade 1 school-aged children in US. Also, tobacco use in a pregnancy can lead to intrauterine growth restriction, preterm labor, and high risk of sudden infant death syndrome. Consequences of drug use during pregnancy. Neonatal abstinence syndrome, also called NAS. As indicated, NAS among the most severe outcome of prenatal opioid exposure. The incidence of NAS has increased significantly in United States. Statistically indicate increase in the number of babies born with NAS within the US by 82% from 2010 to 2017. More so, these increases were noted in all states' demographic groups, according to the data shown by CDC 2024b. Infants with NAS often require longer hospital stays as well as specialized care due to the withdrawal symptoms that occur and experienced, including seizures and poor feedings. Fetal alcohol spectrum disorder, also called FASDs, indicate in the research FASDs comprise numerous neurodevelopmental impairment caused by prenatal alcohol exposure. More so, children affected by FASDs may experience learning disabilities, attention deficit, and impaired social interaction, according to Popova 2019 study. It is important that the patient education is incorporated during the prenatal care to help women improve their comprehension of the risk linked to the alcohol consumption during pregnancy. Hence, complete abstinence would be most recommended approach. Birth defect and developmental delays. Prenatal drug exposure may also lead to structural birth defects, including congenital heart disease, lip deformities, and neural tube defects. In addition, developmental delays and intellectual disabilities are also quite common among infants exposed to harmful substances in utero. A study finding by Venn in 2021 found that maternal opioid use was linked to the higher risk of a minor congenital malformalities in the musculoskeletal system with the third trimester. Prevention strategies and intervention. It is important to encourage women to seek early and regular prenatal care to be able to diagnose and manage substance use during the pregnancy period. More so, it is very vital that they are aware that attending prenatal care program ensure timely interventions and reduce their risk of adverse pregnancy outcomes. Consequently, screening tools like substance use risk profile pregnancy, also called SURPP, can be recommended to providers to help assess and support at risk women. MET for opioid dependence. MET stands for medication associated treatment. Management for opioid dependence can include MAT, including medication like methadone and buprenorphine. According to the Patrick Study 2020, MAT has been shown to reduce the severity of NAS and improve pregnancy outcomes for opioid dependent mothers. Therefore, this approach should be incorporated alongside a behavior therapy to help pregnant women manage addiction while reducing harm to the fetus. Public health policies and education. Many women may not be aware of the risk of drug use during pregnancy. Hence, public health initiatives play an important role in raising awareness about the danger of drug use during pregnancy. Campaigns such as a Talk They Hear You by Substance Abuse and Mental Health Services Administration, also called as SAMHSA, has been known to focus on educating mothers about the risk associated with the substance use during the pregnancy period. Also, the implementation of a policy regulating the prescription of high-risk medication to pregnant women can help to reduce the fetal exposure to harmful drugs, according to the GOSH study in 2023. Counseling and supportive groups. Provider can utilize the counseling services to provide emotional and psychological support to pregnant mothers struggling with the substance use in their pregnancy. The incorporation of the programs such as a cognitive behavior therapy has also been noted to be highly effective in reducing drug use among the pregnant women. Additionally, women can be referred to the support group and community resources for more assistance in maintaining sobriety during their pregnancy period. Conclusion. This research concludes that drug use during the pregnancy phase holds a hefty severe consequences for both mother and infant. In turn, there is an urgent need for implementation of prevention and intervention strategies, increased awareness, pharmacotherapy, counseling, as well as a policy efforts are needed to mitigate the high prevalence of the issue at hand. More so, multidisciplinary approaches that include healthcare professionals, policymakers, community support networks, and others can help to improve the maternal and neonatal outcomes. These are the references I used for my study. Thank you.